Established in 1999, V Groups began its journey as a specialized service provider in the Occupational Health Services (OHC) sector, operating in the South India region with a base in Hyderabad, Andhra Pradesh. In 2005, the company expanded its offerings to include equipment services, demonstrating a commitment to adaptability and growth. Over the years, V Groups further diversified its portfolio, introducing equipment rentals and comprehensive maintenance services, including AMC, Annual Maintenance Contract, and CMC, Comprehensive Maintenance Contract, for machines. With a pan-India presence and a global footprint in Dubai and the United Kingdom, V Groups has positioned itself as a versatile and reliable player in the equipment services industry.
Anemia. What is anemia? Anemia is a condition characterized by a decrease in the number of red blood cells, RBCs, or a reduction in the concentration of hemoglobin in the blood, leading to a diminished capacity to carry oxygen throughout the body. This results in various symptoms, ranging from mild fatigue to more severe complications, depending on the severity and underlying cause of the anemia. Causes of anemia. Anemia can result from various factors, broadly categorized into three main mechanisms. 1. Decreased RBC production. Nutritional deficiencies, lack of essential nutrients like iron, vitamin B12, or folate can impair the body's ability to produce adequate RBCs. Chronic diseases, conditions such as chronic kidney disease, cancer, and chronic inflammation can disrupt erythropoiesis, RBC production. Bone marrow disorders, aplastic anemia, myelodysplastic syndromes, and leukemia can affect the bone marrow's ability to produce RBCs. 2. Increased RBC destruction, hemolysis. Inherited conditions, sickle cell anemia, thalassemia, and hereditary spherocytosis can lead to premature destruction of RBCs. Autoimmune disorders. Autoimmune hemolytic anemia occurs when the body's immune system mistakenly attacks its RBCs. Infections. Certain infections, such as malaria, can cause the destruction of RBCs. 3. Blood loss. Acute blood loss, trauma, surgery, or gastrointestinal bleeding can lead to rapid loss of RBCs. Chronic blood loss, slow, persistent blood loss due to conditions like peptic ulcers, colorectal cancer, or heavy menstruation can result in anemia over time. Symptoms of anemia. The symptoms of anemia vary based on the severity and underlying cause but may include fatigue and weakness, pale or yellowish skin, pallor, shortness of breath, dizziness or lightheadedness, cold hands and feet, chest pain or irregular heartbeats, tachycardia, headaches, difficulty concentrating. Types of anemia. Anemia can be classified based on the underlying cause, RBC morphology, or specific characteristics of the condition. 1. Iron deficiency anemia, caused by insufficient iron, often due to inadequate dietary intake, chronic blood loss, or poor absorption. 2. Vitamin deficiency anemia. Pernicious anemia, resulting from vitamin B12 deficiency, often due to impaired absorption. Folate deficiency anemia, caused by a lack of folate, crucial for RBC production. 3. Hemolytic anemia, due to the premature destruction of RBCs, as seen in conditions like sickle cell anemia or autoimmune hemolytic anemia. 4. Aplastic anemia, a rare but serious condition where the bone marrow fails to produce enough RBCs, WBCs, and platelets. 5. Sickle cell anemia, an inherited disorder causing RBCs to become misshapen and prone to rupture. 6. Thalassemia, a genetic disorder leading to abnormal hemoglobin production and resulting in the destruction of RBCs. 7. Anemia of chronic disease, associated with chronic illnesses that interfere with RBC production. Diagnosis of anemia. Diagnosing anemia typically involves the following steps. 1. Medical history and physical examination. A thorough history can help identify potential causes, while physical examination may reveal signs of anemia such as pallor, jaundice, or splenomegaly. 2. Complete blood count, CBC. The CBC is the cornerstone of anemia diagnosis. It measures hemoglobin concentration, hematocrit, and RBC count. The mean corpuscular volume, MCV, helps classify anemia as microcytic, normocytic, or macrocytic. 3. Peripheral blood smear. Examination of RBC morphology under a microscope can provide clues about the type of anemia. 4. Reticulocyte count. This test assesses the bone marrow's response to anemia by measuring the number of young RBCs, reticulocytes, in the blood. 5. Iron studies. Tests such as serum ferritin, serum iron, total iron binding capacity, TIBC, and transferrin saturation help diagnose iron deficiency anemia. 6. Vitamin B12 and folate levels. These tests are essential for diagnosing vitamin deficiency anemias. 7. Bone marrow biopsy. In cases of unexplained anemia or suspected bone marrow disorders, a bone marrow biopsy may be necessary. Treatment of anemia. Treatment of anemia depends on the underlying cause. 1. Iron deficiency anemia. Oral iron supplements. Ferrous sulfate is commonly prescribed. Intravenous iron, for those who cannot tolerate oral iron or have severe deficiency. Dietary changes, increasing iron-rich foods like red meat, beans, and leafy greens. 2. Vitamin deficiency anemia. Vitamin B12 injections, for pernicious anemia or severe B12 deficiency. Oral folate supplements, for folate deficiency anemia. 3. Hemolytic anemia. Corticosteroids or immunosuppressants, for autoimmune hemolytic anemia. Blood transfusions, in severe cases. Treatment of underlying causes, such as infections or cessation of offending drugs. 4. Aplastic anemia. Bone marrow transplant, the treatment of choice in severe cases, especially in younger patients. Immunosuppressive therapy, for patients not eligible for transplantation. 5. Sickle cell anemia. Hydroxyurea, to reduce the frequency of pain crises. Blood transfusions, for severe anemia or complications. Stem cell transplant, the only potential cure, though it carries significant risks. 6. Anemia of chronic disease. Treatment of the underlying disease, the primary approach. Erythropoiesis-stimulating agents, ESAs, may be used in some cases. Medications for anemia. Iron supplements, ferrous sulfate, ferrous gluconate, and intravenous iron formulations. Vitamin B12, cyanocobalamin injections or oral supplements. Folate supplements, folic acid tablets. Erythropoiesis-stimulating agents, ESAs, epoetin alpha or darbepoetin alpha. Corticosteroids, for autoimmune hemolytic anemia. Hydroxyurea, for sickle cell anemia. Prevention of anemia. Preventive measures depend on the type of anemia. 1. Dietary changes, consuming a balanced diet rich in iron, vitamin B12, and folate can prevent nutritional deficiencies. Include foods like lean meats, eggs, dairy, fortified cereals, and leafy greens. 2. Regular screening. High-risk groups, such as pregnant women and those with chronic diseases, should undergo regular screening for anemia. 3. Prenatal care. Pregnant women should take prenatal vitamins containing iron and folate to prevent anemia. 4. Managing chronic conditions. Effective management of chronic diseases like kidney disease, diabetes, and autoimmune disorders can reduce the risk of anemia. 5. Avoiding risk factors, minimizing exposure to toxins, avoiding excessive alcohol consumption, and managing blood loss, for example, through proper treatment of heavy menstrual bleeding, can prevent anemia. Conclusion. Anemia is a multifaceted condition with various causes, types, and treatment options. Understanding the underlying cause is crucial for effective management. Early diagnosis and appropriate treatment can significantly improve patient outcomes, while preventive measures can reduce the risk of anemia in susceptible populations.